Put simply, our healthcare problem is our deficit problem. Nothing else even comes close.
With the adoption of healthcare reform legislation, it is more important than ever that we find ways to reform our healthcare system. Otherwise, costs of healthcare, including the cost of newly enacted benefits and subsidies, will continue to rise, putting our fiscal outlook at even greater risk.
If I were to worry about how we're going to have a sustainable financial future for the United States, healthcare would be at the top of the list of things I would worry about.
Well, I would say long-term, the story is overwhelmingly a story of healthcare. Our healthcare costs are way out of line with the rest of the world, and they're projected to get even more out of line in coming decades.
We have a Medicare cost crisis, but it's even more true that we have a national health cost crisis. We cannot solve the Medicare cost problem unless we solve the problem of cost for all of our nation's health care.
People want health care, and the average cost is rising very, very rapidly.
This country spends more per person on health care than any other country, and by no metrics are we getting the most for our money. So there's clearly a problem of what we're getting for all the money we're spending.
As educated as I feel like I am, I still feel disenfranchised from the conversation. I don't think I could even get involved with it.
The healthcare conversation, because you don't understand it.
Don't get it.
There's this feeling of all these benefits that we used to get are getting harder and harder and harder to come by because of the costs. And I don't know where the costs lie. Is it the fault of the insurance companies, or is it the fault of the medical providers because they're doing unnecessary things? It's kind of hard to sort it out.
We have a health system that, in terms of cost, is really out of control. And if you take this line and you project what has been happening into the future, we will get less and less competitive. So we need something else. That kind of a cost compared to the rest of the world is really, it's like a tapeworm eating, at our economic body.
Well, failure to reform our healthcare system leads to two problems. First, the quality of care will remain as remarkably uneven and inadequate as it is now. And secondly, healthcare for my children will become unaffordable. The opportunity to reform medical care for the entire population is tremendous. We can improve quality while slowing the growth in healthcare spending to something that's affordable.
Slowing the rate of growth of health spending by only 0.1% a year, and that alone would save $4 trillion over time. Surely to goodness we can shave off 0.1% of our growth rate.
But we ought to be trying now a number of strategies that will slow the growth of healthcare costs.
The passage of the healthcare bill is just the beginning. Now the real work begins. We must address the rapid growth in healthcare costs, which is absolutely essential to our economic and fiscal future. To do this, we will need to make a number of changes in the way healthcare is delivered, financed, and consumed.
We have to look at the way we pay our doctors and our hospitals.
The current way we pay for most healthcare in the United States is with an individual fee for a specific service, referred to as fee-for-service medicine. We pay hospitals that way, by and large, and we pay physicians that way. That rewards physicians for doing more services regardless of whether they're beneficial to the individual patient or not. It rewards hospitals for keeping their beds full, even if it's better for the patients not to be readmitted.
And one of the most important things for the public and for the profession to understand is that more is not necessarily better when it comes to health.
We basically have a delivery system which rewards quantity over quality and does not tie quality to value.
So we need to move away from fee-for-service payment. The second issue is that we have a fragmented delivery system where hospitals, physicians, nursing homes, each are working independently with no coordination among them. So the fragmentation in the U.S. healthcare delivery system is one of the problems we think is so important to address. Electronic medical records have tremendous potential to help with the problems faced by American healthcare. So by providing a common record that all of the physicians who are taking care of you can see could markedly improve coordination. If you have a chronic illness, you need your care taken care of over months and years, and we have no accountability anywhere in the system to improve your care as an individual. Putting those things together, better payment systems, better information systems, and ways of holding physicians accountable with hospitals, then we could really drive improvement in the healthcare system.
Some other ways include enacting malpractice reform, reducing administrative processes, reducing medical errors, and creating smarter healthcare consumers. In the current health insurance system, patients are often unaware of the true cost of medical tests and procedures. When you purchase something from a store, it comes along with a clear price tag. The same should be true of healthcare services.
With respect to healthcare, a large fraction of it is not paid out of pocket, but rather paid by insurance, so we are insensitive to prices.
One way to change this is to show the total cost of compensation, including the employer's share of the healthcare insurance, on pay stubs. This way, employees can see how much of their compensation is in healthcare, not just cash. Finally, we need better decisions about end-of-life care. About 30% of all Medicare payments are on behalf of people who will die within a year. We should encourage compassionate ways to handle difficult health decisions at the end of life that will lead to appropriate levels of care. These and other steps can help slow the rate of growth through our entire healthcare system, which is one of the biggest cost drivers in federal healthcare programs. Beyond slowing the rate of healthcare cost growth, there are other steps we can take to make our healthcare system sustainable. As a nation, we need to adopt healthier lifestyles.
It's important for us to recognize that how we live our lives has a huge impact on our future health.
The biggest thing to think about is how to get the public engaged in becoming a healthier nation so that people don't get sick in the first place. Well, people with multiple chronic diseases spend most of the Medicare money. So that's the target. That's where we need to focus.
The fact that we do not promote healthy lifestyles in the marketplace, we should give people incentives, cash incentives to pursue healthy lifestyles and prevention activity.
More physical exercise, healthier diets, less smoking.
All of these things contribute to a reduction in vulnerability to chronic disease and to disability and to illness and to hospitalization. So there is a cascade of benefits that have payoffs in health and payoffs in dollar savings.
That would reduce the cost of care, but most importantly, it would make us all feel better.
The new healthcare reform legislation assumes that Medicare providers will be paid less. Those savings may prove difficult to achieve. As a result, we will need to look at other ways to control the cost of federal health programs, especially the growth in Medicare.
The rising costs of federal health programs are the most important threat to the fiscal sustainability of the U.S. government. Medicare is the largest component of that threat. So reforming Medicare in a way that improves care while reducing costs is a critical challenge facing our country at this moment.
Right now, all the programs are an automatic pilot. There is no limit to how much the government will pay for your health care.
We might have to look at putting a cap on federal health care spending to see whether that will help make these hard choices, because right now we have an open-ended system, and so nobody has an incentive to control costs.
The Medicare problem, of course, is that the population eligible for Medicare, the elderly, is going to expand at a very rapid rate, and so the number of beneficiaries will increase, and with it the costs of the program.
Another way to improve the financial strength of our Medicare program is to gradually raise the premiums for Medicare Part B, which includes outpatient care, doctors' services, physical or occupational therapy, and Part D, prescription drug benefits, both of which are voluntary programs, while providing financial assistance for those who need it. This would take a huge bite of our growing Medicare deficits and do so in a progressive manner, protecting those of lower means. And finally, if we gradually raise the eligibility age of Medicare, we will greatly enhance our nation's ability to offer effective healthcare programs to those who pay into it. This is not something that should be phased in quickly. It could be phased in over the next 10 to 20 years in an effort to give those who would be affected more time to plan for the changes.
Reforming Medicare is essentially the same as trying to reform our healthcare system. And to fix healthcare, we need not only Medicare, but all of the other payers to help physicians and hospitals come together to reform care and slow the growth of healthcare spending.
Unfunded Medicare costs will reach a staggering $38 trillion over the next 75 years. This is the greatest fiscal problem facing our nation.
Most Americans think we face an awful choice. We have to spend more and bankrupt ourselves or ration care. I think what the research shows quite clearly is that there is a third choice. We can redesign care so that healthcare is both affordable, covers everybody, and is better quality of care.
Finding ways to reduce overall healthcare spending and achieve savings in Medicare will be key to lowering future debt levels. When it comes to our exploding debt, nothing has a greater impact on it than our healthcare system. To the extent that we can fix our healthcare system and rein in cost, we will improve our financial situation. However, whatever we don't fix through healthcare, Social Security, and our defense and other spending policies, we will have to make up in the area of taxes.